Hi, everybody. I am Javier Lera. Within this module 2, the Grünau Moves, a best practice to promote health and prevent obesity in children. We are here in the lesson 4, Grünau Moves, co-design a local action program, local action programs, case studies. In this case, I will try to explain you with my colleagues, Dr. Cabero, Professor Cantarero, Oliver, Paloma, and Marina, what's our experience here in Cantabria within the Valdecilla Biomedical Research Institute in Spain. So let's go.
The collective co-design process of the local action program in Torrelavega, Cantabria, Spain, was based on an intersectorial and participatory approach, focused on identify specific needs in vulnerable school settings. The project was developed in 2 neighborhoods with a high immigrant population and families in socioeconomically vulnerable situations, Covadonga and the Inmobiliaria.
Now we're going to talk about the collective co-design process of the local action program. What about the two sides of this slide? First of all, I'm going to talk about the local working groups. The idea is that 2 local working groups are formed, one in each neighbor, serving as many spaces for deliberation, safe diagnosis, collaborative design. We really think that these 2 groups bring together several key community stakeholders about the schools, the social service, the local association, educational authorities, and moreover. From the other side, the problem identification, we really think too that the active participation of the stakeholders allow for the identification of child and adolescent health problems. We're talking about excess weight, obesity, sedentary lifestyles, and these kind of things. The diagnosis is based on quantitative data and the chain of knowledge among the stakeholders. And I think that this is the idea. The collective co-design process of the local action program is based on two parts. First of all, the challenge and overcoming. From this perspective, the process faces many obstacles, uneven involvement and overburdened service. Moreover, the challenge, are overcome thanks to active community networks, the teacher leaderships, and a shared sense of responsibility among those involved. And finally, I'm going to talk about the design of intervention proposals. From this perspective, again, the community proposals are developed with a collaborative and equitable approach, addressing several criteria of feasibility, sustainability, and pedagogical coherence, or this kind of disentangle linked to existing resource in the area. Finally, the schools are both address and drivers of change.
Examples of community events in pilot sites to prioritize local actions. In the framework of the local action program, actions have been implemented to strengthen health promotion in schools, aligned with an intersectoral and participatory approach. Action number 1, training and evaluation session on childhood obesity. Aim to train teaching staff on risk factors associated with childhood obesity and preventive measures in the school setting. Participants, teaching staff from educational centers with the participation of nursing staff from the Marqués de Valdecilla University Hospital. Method, informative talk followed by a joint reflection to assess the role of teachers in the promoting healthy habits. And accessibility, the session who's adapted to need and previous knowledge of the teachers as part of the program formatting evaluation strategy. And the action number 2, data and support of the new health promotion model. I'm to update and support teachers on the new regulatory framework for school health promoted by the regional Ministry of Education of Cantabria. It has 3 phases. Number 1, informative presentation on the new school health model. Number 2, design of the school health plan by the centers adapted to their needs. And finally, review and sharing of the plan decided, sharing lessons learned and good practice. Participants, teaching staff from primary schools, accessibility sequences sessions adapted to the specific needs of each school with emphasis on participation and collaborative work. Finally, impact. These actions exemplify the shift from top-down intervention model to a transformative and inclusive approach in which schools play a proactive role in creating healthy schools environments.
According to the barriers, although many programs are framed within strategies that promote cooperation between sectors, in practice there is insufficient coordination among the actors involved. In addition, factors such as lack of knowledge of the educational system, institutional distrust, or language difficulties have an effect on the participation of the families. On the other hand, the participation of teachers is limited by the high bureaucratic burden and the inherent daily pressures in complex contexts. Also, the existence of multiple programs and resources doesn't always translate into a coherent and sustained strategy. And finally, when intersectional approaches are not applied, the educational system itself can reproduce the same dynamics of exclusion that are intended to be reversed. As key facilitators, we have found the presence of neighborhood associations, NGOs, local platforms, or informal leadership, which facilitates the mobilization of resources and the generation of trust in the school environment. Management and teaching teams with a transformative vision represent a fundamental driving force for the change. Adjusting actions to the cultural, religious, and linguistic diversity of the educational community is key to their effectiveness, and the incorporation of mediators, materials that could be accessible for the communication and greater adherence by families. When programs align with consolidated public policies, the possibilities of obtaining resources and continuity are increased. And finally, the evaluation system that integrates the voices of different actors, reinforce collective commitment, and allow actions to be adjusted to the real needs of their environment.
So all in all, some of the recommendations that from our team we have identified here, our experience in Cantabria. So first of all, it's a participatory community assessment. We need to identify health needs. We need to identify all the values we've got in our neighborhood, and of course, our assets. What are the things we can count on in order to design this action program? We need both quantitative and qualitative data, both for designing them and later for evaluating what we have done. Why we need this? Well, in this process, we need to include the voices of teachers, students, kids, families, and all the local stakeholders, policymakers, NGOs, whatever it is involved in the neighborhood. Every stakeholder has to be included in this assessment. The second thing is sustainable intersectoral partnerships. So we need to create a coordination team between the education, health, and the social sector. So we need somebody to coordinate all these stakeholders. So we need to promote horizontal relationships and shared objectives. So we need to focus on look for that objectives that we all the stakeholders involved share, we can agree on. So with all of that, we can later go to the co-design with an equity focus. So we need to involve all the community when planning this kind of action programs. And one of the key things is we need to take always into account the equity focus. We need to put sunglasses based on the equity. Okay, we need to serve vulnerable groups with an intercultural and social justice perspective. Okay, that's one of the three first things that we need.
Key ideas for co-designing local action program in school are: first, it is important to use activity learning approach. Health promotion should be integrated into the school curriculum through meaningful and real-life activities, things like project-based learning. And we have seen that subjects like physical education and tutorial sessions are really valuable space to help students develop physical, emotional, social, and even digital health skills. Second, we need to set up a system of ongoing participatory evaluation. That means combining quantitative data like physical activity levels, perceived health, attendance, or academic performance, with qualitative insights from students, families, and staff. The idea is not just to evaluate for the sake of it, but to use the result to improve the program over time. And third, communication needs to be clear and culturally appropriate. That means using simple language, visual formats, and translating materials when needed. It also helps to work closely with cultural mediators, local associations, and or open informal networks within the school community. All of with it can really help with trust with families. So in the end, if we want this program to be meaningful and sustainable, they need to be based on community participation, equity, intersectoral collaboration, and cultural sensitive. That's what really makes a difference. Thank you very much.